Good evening, everyone, or good morning from wherever you're dialing in around the world, and welcome to our webinar this evening on SAR OK. My name's Alex Barrell. I'm the CEO and Commissioner of Marine Rescue New South Wales here in Sydney, Australia, and I'm also on the board and trustees of the International Maritime Rescue Federation. I'm extremely honoured, I guess, and privileged to be chairing this webinar tonight. Again, I'd just like to welcome everyone that's online at the moment and thank you for taking the time out of your busy schedules from wherever you are around the world. And I can see already coming up in the chat, we have some people online from New Zealand, Finland, Germany, Malaysia and Poland, and the list is getting longer as I speak. So welcome to everyone that's online and I look forward to this session that lies ahead. I would also just like to welcome our two guest presenters tonight online, which we'll hear from shortly. The first being Chief Inspector Gary Raymond, APN and OAM, retired from the New South Wales Police, who will be giving a presentation shortly, and also Ari Peach, who's the National Wellbeing Lead for Surf Life Saving in New Zealand. So welcome to both Gary and Ari. For those online, a very quick overview of the session. As I said, my name is Alex Barrell, Commissioner and CEO of Marine Rescue New South Wales. After a very quick introduction from myself, we'll start with session one, which is Blame Your Brain, Answers to Critical Incident Stress, Post-Traumatic Stress and Post-Traumatic Stress Disorder by Chief Inspector Gary Raymond, retired of the New South Wales Police Force. And session two, Developing a Peer Support Program to Support Surf Lifeguards in New Zealand, by Ari Peach, the National Wellbeing Lead at Surf Life Saving Australia. And that will be followed by an open forum. So I do encourage everyone that is online to use the chat function, which you'll see on the right-hand side of your screen. This is not an open mic session where there'll be an opportunity for you to, I guess, raise your hand and ask questions. So please do encourage you to answer or to type some questions, which I'll be monitoring through both of those presentations, and obviously very keen to come back to those. It goes without saying that this webinar today is an initiative of the IMRF's SAR OK and coincides with the International Day for World Mental Health, which is an IMO initiative. And this year's theme is Mental Health is a Universal Human Right. And the banner of this year is Our Minds and Our Rights. And I think both of those statements tie in very nicely with what I know will be the session from both Gary and Ari later on tonight. As I touched on, this is part of the initiative of SAR OK. That's an International Maritime Rescue Federation initiative which started back in 2022, and already the Federation has been working hard through Caroline and the trustee board and also many of the member agencies to really develop this initiative since 2022, and I know that there's some great plans leading into the future to really grow this initiative and look for alignment and synergies around other things like that we are doing today around World Mental Health Day. Obviously, the SAR OK initiative came about really as a representation that first responders and maritime SAR first responders, I guess, are overrepresented or have the opportunity to be overrepresented with mental health issues just due to the nature of the work and responses that they attend to. And really part of this initiative is looking for opportunities where we can develop some commonality around best practice around the world and amongst our member agencies so that we can provide that better guidance to all of our member agencies to improve the wellbeing of our members, whether paid or volunteer. This initiative for me is very close to my heart, being a first responder now for a little over 35 years, and I'll touch on that. Now, before we do kick into the session, I thought it was really important tonight just to acknowledge the suffering of those that are caught up, firstly in the terrorist attack over the weekend, and now there are those that are caught up in the ensuing conflict over in Israel and the Middle East there, as representing agencies that really set about every day to provide safety and security and to pull people from harm's way. We can very hard to imagine the pain and suffering that's been experienced by so many in that part of the world now. And I know that I'm sure each of our thoughts are with those people impacted in that part of the world, and we know that our present thoughts are with them. Really important that everyone online really does use their membership as part of the International Maritime Rescue Federation to stay engaged, to make sure that they're supporting the initiatives of the IMRF, and really as a member of the board, and also working very closely with Caroline as the CEO and Tom Scott, who's online tonight. We're really keen to hear the experiences of all those agencies, and we really hope that you can remain engaged and look for opportunities to remain engaged with the initiatives that that we are running as part of the IMRF. Again, as I said, welcome to all of those online. I'm looking forward to the session that lies ahead. And just as a reminder, please put your questions into the chat box. I will look for opportunities to review those when both Gary and Ari are speaking, and I'll make sure when we get to the questions at the end, we'll have an opportunity to discuss some of those as part of the panel discussion. Probably what I didn't touch on is that we're looking to have this wrapped up in an hour and 15 to an hour and a half today. And I know most of you obviously got very, very busy schedules, and we want to make sure that we stick to time. So that will be the platform that we're operating off there. As I touched on just very briefly, this is an initiative that's very close to my heart. Being a first responder now for over 35 years, I started as a young volunteer surf lifesaver in Australia before becoming a professional beach guard both in Australia and over in the Channel Islands, before joining the police force back in the early 90s. And in preparation for this session, it made me reflect very much on my experiences in my career, particularly as a young person, where you build those exposures over a long period of time. And you probably, when you're young, and what you think is bulletproof, you really don't focus on your mental well-being. And I think this is a reminder now, 35 years on, that you do have to actually manage your mental well-being from a very early age when you're part of the emergency responders, and come up with mechanisms to continue to monitor and monitor your own welfare and support those around you. I put this slide up really because in preparation for tonight, as I said, I did some reflection around what it's meant to me over the years from my professional background, but also reflect on some of the traumatic experiences that I think I've been a part of over the years. And the picture on the left there is that's me as a young police diver, probably around the age of 22 back in the early 90s, being really thrust into probably what was a career that was very challenging, presented with many life challenges, some very grisly jobs from time to time, and really at the front line of some really tragic incidents. And on the right, obviously, is a backpack. And I think over my career, I've always looked at my exposures or managed my mental well-being, as you do with your workload, is really around a backpack of life. And for me, in this presentation, it's around that backpack of exposures and what I've had over the last 35 years. And going back, I remember that I kept a scrapbook very early on in my police diving career, which really was just an opportunity for me to pull out some of the jobs from the media that I was exposed to. And what I did as part of this presentation, I went back to a 2-year period between 1999 and 2000, so the start of 1999 and to the end of 2000, and pulled together just a slide of some of the jobs that I was involved in over that period of time. And really, for me, when I look back and reflect on this, and I'm sure you can all see this is probably a little bit of a clippings of, I guess, as to what was in my backpack over that 2 years. And you can see just by the headlines, these were jobs I was all individually exposed to, and in most cases probably got in the water to look for the people that are listed in these news articles as missing or lost at sea, and recovered them either from the ocean floor or from inside boats or the like. And now when I look back, I think, for a young 22 and a young 23-year-old police diver over a very short period of time, this is just a snapshot of some of the more traumatic and I guess grisly jobs that I was involved in over that period of time. And you probably all cast your mind back, those that are old enough, back to the 90s and even beyond, that a real focus on mental wellbeing amongst workers and SAR first responders was not really there. Our opportunity to debrief after these was not really there. Our opportunities from an organisational perspective was not really there either. There wasn't that support offered to us. Support was provided by our work peers, The police diving unit at the time was a unit of 12 officers that travelled around our jurisdiction and undertook these jobs. So without that mateship and camaraderie, there was no other form of support provided to us. And I think we've come such a long way now over the last 20 to 30 years, hence days like this and opportunities and webinars like this. So, this is really just a very small snapshot around what this webinar tonight means to me. One of my colleagues over this period of time, I lost in about 2008 to suicide from PTSD that he suffered as a police diver and a New South Wales police officer. So, as I said, this is something that's very close to my heart. So, look, I hope you all get something out of tonight. As I said, please encourage you to use that chat function. And what I'll do now is throw over to Chief Inspector Gary Raymond to start his presentation. But what I will do before that is just introduce Gary. Gary's got a very long history. I knew Gary from his time back in the New South Wales Police Force. He provided support on many occasions to the New South Wales Police Diving Unit. He's an operational practitioner, and since leaving the New South Wales Police, he's carried out his role in supporting agencies right across the emergency services framework in Australia, and continues to do that, both serving first responders that have left organisations and now still dealing with the trauma that they carry with them, and also members of the military. I know that he's tied up with and he's a padre for the Return Services League sub-branch here in Sydney. So, look, your background and your history, Gary, is too long to read. I welcome you to the webinar. I thank you for taking up the time tonight to come and present this international forum, and I'll throw over to you.
Good on you. Thanks, Alex, and very much looking forward to doing this, and welcome everybody. And Alex, thanks for your service. You're amazing operative and now managing this amazing organisation for Marine Rescue New South Wales, and looking forward to listening to Ari as well, because peer support is very close to my heart. Well, I've entitled this one, Blame Your Brain. Very interesting. This is a major breakthrough when dealing with traumatisation of operatives. A major breakthrough. I just want to say to you, as we're talking, you may get flashbacks of some of the things that you've been involved in personally, and some of the situations that have sorely challenged you. It might be on the job, it might be off the job, but the fact that we're talking about this may trigger memories. That's normal and unavoidable. But if that happens, just reach out to your support services within your organisation. Don't be frightened to reach out, because there's people surrounding you and willing to support you. Now, I promise the wow promise with this session. Wow means, wow, Gary, I've never heard that before. Wow, Gary, that is a breakthrough. Wow, Gary, I wish I'd have known that some time ago. Gary, wow, that is amazing. And you notice the actual title of Blame Your Brain. What we used to do in the past is blame the person. Oh, so-and-so's stressed. Or so-and-so's lost it. Or so-and-so can't manage. But we've changed that language now, and this might be a wow moment. We don't say the person. We say blame your brain. Let me explain. The major breakthrough is for critical incident stress, that is CIS, post-trauma stress or PTS, post-traumatic stress disorder or PTSD, and there's grief and complex grief as well. Very interesting, the PTSD, a lot of people get that mixed up between the post-traumatic stress and post-traumatic stress disorder. The disorder means that the operative doesn't get out of bed, gets their food delivered, won't go out socially, won't do anything at all to mix with people, to go and to do their job. They bunker down and they start hallucinating. They might even have psychotic moments. They start drinking heavily. Their lives are really disordered. And there's about 200 police officers and ambulance officers here in New South Wales become disordered. The rest are just simply post-traumatic stress. Now, let me explain. Here's some questions. So we've got to separate the brain from the person. Now, the brain is this blob of grey matter that works on chemistry and electricity. I was an ambulance officer prior to joining the police force, going into the rescue squad. And so when you learn that the person is their personality, their moral values, their character, their worldview, their beliefs, that's the person. And the brain is a chemical blob. Separate them because they're two separate identities. They do interact and cause interaction between each other, but they're two separate identities. And that's been the major breakthrough in helping people understand this traumatization. Now, here's a question. Does your brain and mine have a control room? Well, it does. It has 4 control rooms at different levels of the brain. I'm not going to go into the terminology or the anatomy, but just to let you know that the brain is similar to, I guess, the marine rescue. When an accident happens or some other thing on the water, under the water, someone sees it. Then they ring whatever emergency number is in your country, and that sets chain of action in place till then there's a response. Your brain's the same. When you think of something or see something or will sight sounds, hear something, and I've added silences because often for marine rescue operatives and others, silences are impacting. For example, sadly, we might get a child who's drowned in the surf and resuscitation's not worked. And then that little kid who used to be laughing and running and screaming and singing and there's no longer, there's silence there. And of course, there's the touches, sights, sounds, smells, silences and touches. That's called the sensory stimuli. That sets the brain in action. So the brain has a control room. So when the brain controls you, blame the brain, not the person. Well, is your brain a standover merchant? It is. Your brain is so strong, it stands over you and the operatives and the crew under your command, and it actually has the ability to take over a person. No permission, no allowing the brain to do that. It just does it. And let me explain that. So don't blame the person, blame the brain. So does your brain have a brake and an accelerator? Guess what it does? Part of the brain is to do with depression and part of it to do with anxiety. Now, sometimes you might get a marine rescue crew who go through a horrendous incident, whatever that is, whether it's raging rough seas or picking up people who have drowned or a boat literally breaking up in front of them, whatever it is, and the brain reacts to that sight, sound, smell and touch. And if later on, back at their crew base or back at the wharf or wherever they are, sometimes what happens is the brain's brake gets locked on and they go into a deep depression. The brake's locked on and sometimes the accelerator gets locked on. That's anxiety or panic or uptightness, or we often loosely call it they're jumpy. And sometimes the accelerator locks on, locks off, the brake locks on, locks off, and that's sort of almost like people describe it as a roller coaster of emotions, happiness, sadness, fear, courage, all of these different emotions. That's the brain. Blame the brain for that. The person doesn't put the lock on. The brain puts the lock on. Now, does your brain tattoo your memories chemically on itself? This might be a wow moment, but your memories are actually tattooed chemically on your brain. And there's a drawer, if you like, or a filing cabinet of memories. Your brain's a video camera. It records everything, every single thing, and then it categorizes that recording according to their stressfulness, if you like. And so your brain does actually tattoo your memory. People say, oh, just forget it. You can't. It's impossible. It's tattooed. Now, we know that tattoos on the body, I haven't got any, but many have, the tattoos on the body do fade in time, but they're still there. And the brain can do that. Some of the memories fade away when they're not that significant to you, but others stay around for a long time. Now, does your brain categorize and file your memories? Yes, it does. What happens when you get an incident, a sight, sound, smell, or touch, and it actually files it. Now, if it's insignificant, not worth remembering, it puts it at the back of the filing cabinet drawer. But something that's impacted your crew person, which has been horrific and challenging and threatening, the brain files it at the front of the drawer so it can deal with it constantly. And these are the bad files, if you like, or the traumatic files at the front of the cabinet. And that's why people say to me, I can't forget, it keeps reminding me. Well, that's your brain, not the person. Blame the brain. Now, does your brain wander around the tenses? Well, guess what? It doesn't. Your brain is very focused on the present tense. Sure, it will remind you of the past and it'll give you fear of the future, but it concentrates on how you are now. For example, it's, is your brain like a radar? Well, it is. When I worked on the police helicopter, we had several screens. One was terrain radar and one was for traffic radar, things in the sky. And we had a sensitivity button. Now we could switch it right up and nearly pick up even a pelican flying in the air around us. Turn it right down, it just picked up big heavy aircraft and nothing else. So we could turn the sensitivity. Your brain has a sensitivity switch. And if you're uptight after a critical incident, the brain turns up the sensitivity and it's looking like a radar for further threats. And it's very hypersensitive and hypervigilant, and anything that comes within that screen, bip, bip, bip. When you calm down, the brain turns the sensitivity down so that only major things are drawn to your attention. So your brain is a radar, and you can't control that. If it keeps looking, because it's looking for threats and challenges, it'll do it whether you want it to do it or not. Now, is your brain a smoke alarm? Wow, Gary, what? The brain catastrophizes and overreacts. And this is what we call critical incident stress or post-traumatic stress, or even, of course, post-traumatic stress disorder. You know, when you're in the kitchen for brekkie and you do a bit of toast in the toaster, and the smoke might go up when you burn the toast. It goes up and it goes up. And the detector on the ceiling, the smoke detector, beep, 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 beep. The detector thinks the house is burning down. Hang on a minute, but it's just a bit of toast. The brain is like that. The brain overreacts to a memory, a flashback, a sight, and a sound and a smell. And so I was talking to an ambulance officer this morning. He was watching television, and then a particular fatal car crash came up on the news. And his brain immediately said to him, look out, remember, you might be in a car crash. What about the ones you've attended? And he started to catastrophize his brain, and he got uptight and rang the helpline. And we explained to him what the brain was doing. So your brain overreacts. Don't blame the person for overreacting. Their brain is taken over and doing that. Does your brain cause dreams, nightmares, or night terrors? Now, this is a wow moment. A lot of police, ambulance, marine rescue, firefighters have trouble with dreams, nightmares, or night terrors. Until you explain what happens, they continue to blame themselves instead of blaming their brain. Let me run you through this. We're all listening now, we're alert, we're thinking through what I'm saying, and we're sorting it out in our mind. So our conscious is awake. That's the day shift. When we go to sleep, the conscious goes to sleep and the subconscious gets up. The subconscious is the night shift. They are absolute dopes. They have no idea of how to run your brain. They have no idea how to run your body. They're just there to keep you ticking over while you're asleep, unless something happens, and then it'll wake you up. The subconscious have no idea of how to run you at all. And so the subconscious, the night shift, while you're asleep, wanders around in your brain, and it'll go to the memory drawer in the filing cabinet. And it'll go through just picking out a random file of memory, just cut a snippet out of it, not the whole lot, 10 years ago, 20 years ago, 30, 40, 50. And then it'll go to yesterday. It'll cut a snipper out of that, snipper out of one 10 years ago, 5, 4, 3. And it gets these short snippets of memory, puts them into a hat and mixes them all up. Then it'll splice them together, your subconscious night shift, in no order or resemblance of order at all. Just splices all these memories together. What happens then? There's more. The special effects team comes in, and they're even worse. They have no idea of reality, no idea of spatial awareness, no idea of science or history or you. They absolutely put things, overlay those memories which are untrue and unrealistic and way, way, way detached. They make a disc, and the night shift, the subconscious, puts it into your brain and plays it. And so you're asleep having a dream, which is a pleasant experience normally, or a nightmare, which is very, very distressing, or a night terror. That's where people start screaming and throwing their fists around while they're asleep in that REM sleep. And so when you wake up, you might wake up with a start, or you might just wake up normally. The conscious, the day shift, comes back on, and the night shift, the subconscious, goes back to sleep. Most people say, wow, that was a horrible nightmare, and I'm awake, it must have been just a dream or a nightmare. So if that's a wow moment, once we explain that to our marine operatives, and those, when I say that too, I mean those in control, radio, logistics, remember the whole family. When we explain it, blame the brain, not the person, they calm right down. Now, does your brain trigger suicide and homicide thoughts? Gary, did you say homicide thoughts? Yes. When someone's depressed or in an anxiety state, one of the questions that we ask is, during this time, are you thinking about taking your own life, or are you planning on taking your own life? I've added a question to that with the ambulance and the police here, is, are you thinking or planning of taking someone else's life as well? Because we find often the suicide, homicide ideation or thoughts come together, particularly if there's been betrayal, what they perceive in a relationship or management or whatever. Betrayal brings out thoughts of homicide as well. But that's for another time, talking more in depth about that. Now, does your brain trigger facts and feelings? Well, it does. Your brain will trigger the facts. That is, I see something really awful. For example, and it's an awful example, but I see a kid floating in the water, lost their life. Now, the brain looks at that rescue from a rescue point of view or recovery, and I'll look at it too from a forensic point of view. Then the other side of the brain will make you sad, and this overwhelming anxiety or sadness or melancholy because this little baby, this little child is not going home to their family. They've lost them forever. And so there's the facts, what we see and deal with, and then there's the feelings. And I used to get that all the time. I'd go to fatalities, and I know Alex and many others do, where you'd feel, yes, I've got to recover the body, but this person that was there is not going home anymore. And there's a loss to these family. They don't know yet, but we've got to knock on the door and tell them. And so the brain triggers those two. Well, finally, last couple, can you control your brain or trick your brain? Here's the wow answer. Remember, a lot of people, when they go through tragic or critical or challenging or threatening incidents, all they want to do is rest. And that's normal. You'd think, wow, that's resting might be the answer. Guess what? It's not. The answer is to do physical exercise after going through a trauma. But Gary, I just want to sit around and stare at the telly or just do nothing or see my family. Or the research clearly shows that we can trick the brain. So the brain, when you go through these, it says sight, sound, smells, touches, and it says fight and flight. Either face it or get out of it. Now, if you don't do that, the brain will continue a tsunami of chemistry and pour these adrenaline rushes all over you continually. And that's where people say, I can't sleep, I can't rest, I don't feel like eating, I don't feel like drinking. And so because the brain thinks the crisis is still on. No one's told the brain the crisis is over and you're safe now. And so by running or walking, depending on your own fitness, of course, or swimming, getting your pulse rate up and your blood pressure up tricks the brain. Oh, they're fighting or flying. So what I'll do now is I'll settle down, I'll stop the chemistry, and I'll pour out some chemistry which helps them to relax, the endorphins and other chemicals to help calm them down. So instead of sitting around, what we do now with the operatives, we get them to do some vigorous exercise after the trauma to trick the brain. You know, can we override the brain during stress? No, we can never. It's got a mind of its own, inverted commas. It will take over for sure. And so how can we trick the brain? Well, one of the ways I mentioned is exercise. The other thing too is people don't feel like drinking water. Some are thirsty and some aren't, and they get dehydrated. Often as an ambulance officer, we attended calls where after a critical incident, people were dehydrated and we had to hydrate them because the brain needs lots of hydration to work efficiently. Have good food, that's important. Don't drink too much alcohol or take too many medications which might affect your brain chemistry and exacerbate it, actually, some of this stuff. And if you're feeling depressed, alcohol's a depressant. And people say in the old days, we went down the pub and we got into it. Well, that was makes it worse because of depressant on top of a depression. And so, and finally, we've got to find out from your operatives what works best for them. Do you know what the first intervention is? No intervention. We're finding in the research here that we can actually intervene too early and stop them being able to deal with it themselves or to mix with their peers or to mix with family and friends. We sometimes rush in or find out some people like one-on-one, others like a group. So we find out what they feel comfortable doing, consult them as to their interventions, if any. Then we go up the ladder to professionals, don't we, to the psychologists, psychiatrists, social workers, and addiction counsellors and so on. And last of all, just reward your people. Reward them so often and so much that they'll really feel very wanted, very worthwhile, and an asset to your organisation. So don't blame the person, blame the brain. Thank you.
That's great. Thanks, Gary. I hope everyone can see and hear me back online. If you give me a nod, Gary, that would be great.
Yeah, gotcha, mate.
Good on you. No, look, thank you very much, Gary. And I think there's some real insights there. One quick question before I do go over to Ari. Gary, if you wouldn't mind, just to stay online, is this is relatively new thinking. And I guess if I was to look back at the people that I've dealt with and worked with over my career, by nature, people in the operations and the emergency services are operational people. They're results driven. They like to have an answer to things. How have you found the transition of thinking, I guess, in the people that you've supported over more recent time? How do you feel, and how have you seen the uptake of this message going, and how are people that are in difficult times responding to this type of thinking?
Absolutely marvellous. It's been breaking through the old thinking, so-and-so's lost it, so-and-so's not coping, so-and-so's upset. And one of the things we tell them now is permission granted to be upset. If you've got a tragedy in front of you, and a matter of fact, I went to a scene where a young boy lost his life in tragic circumstances, and I arrived as the duty officer, the duty inspector in charge of the emergency management crime scene, and there was a policewoman there who I knew, and as I stood beside her, she started to cry because, where she's sketching the crime scene in a notebook for contemporaneous notes. And she turned around and she said, "Excuse me, sir, sorry for crying on the job." And I said to her, "Hey, listen, permission granted to cry on the job and draw your crime scene at the same time." And with that, we both cried. We gave ourselves an appropriate cuddle and we carried on doing our duty. And a matter of fact, only recently I was doing a workshop at a police station where she was at. And as we were walking along the corridor, she saw me. She said, "Hello, Mr. Raymond." I said, "G'day, how you doing?" She took out a notebook, opened it up, and there was blotches on it. She said, look at this. I'm still bloody crying at crime scenes, thanks to you. And we had a laugh together. So we're giving them permission to be human, as well as doing their job firmly and assertively. We're finding the understanding of what the brain's doing. They stop blaming themselves. And we also talk to their families, Alex, because understanding what the brain's doing to their loved one is a major breakthrough at keeping relationships together, not blaming them. "Oh, I thought, you said you want to go out for dinner, and now you're saying you don't. Fancy, what are you up to? Do you really want this marriage to work?" And we're saying to the families, "Hey, listen, it's not him or her. It's their brain shutting down and going into that fight or flight protective mode." We call it the trench syndrome. They just want to hide in a trench and just to stop any things coming over the top. And so it's having a major breakthrough, understanding the anatomy and physiology of the stress response itself.
It's great, Gary. And I'm just looking here. We're getting quite a few questions coming, which is really great. So I encourage everyone. Thanks for those that have sent them through. And there's some lovely comments too, Gary, just around your presentation and how it's rung true with many of our people online tonight. I will save those questions to our panel discussion at the end. So please, everyone online, please keep them coming in. And once again, Gary, I will now go to Ari Peach. Ari's the National Wellbeing Lead for Surf Life Saving New Zealand. Over the last 2 years, Surf Life Saving New Zealand has developed a peer support program to support the mental health and wellbeing of New Zealand's 5,000 surf lifeguards and specialist lifeguard search and rescues teams. The presentation covers how the program was developed and brings to light key learnings from other SAR organisations and how peer support can be used. Ari is responsible for the strategy and delivery of wellbeing support at Surf Life Saving New Zealand. He has a Master's in Paramedic Health and he's a lecturer of applied mental health and wellbeing at the AUT University in Auckland. So thanks for jumping online again tonight, Ari, and I look forward to your presentation, and please keep the questions coming in.
Awesome. Thanks for the intro. And also, thanks, Gary, for your presentation. I found it super interesting and really leads nicely into some of the things that we're talking about for my session here around peer support. So I work for Surf Life Saving New Zealand. I have a really interesting and privileged job of mostly focusing on lifeguard wellbeing. My background is, as a teenager, I was a lifeguard. So I'm 35 years old now. And in New Zealand, you only have to be 14 to be a lifeguard. So we have a huge diversity of ages. So in my teenage years, I did that as kind of my volunteer hobby and then as my paid job through university. And as a young lifeguard, I experienced some pretty intense things. And in particular, I was dealt with a number of body recoveries, resusces and things like that. And it wasn't until I worked as a paramedic and reflected, it was really interesting to see how much pressure some of our membership get put under. And I know in a lot of SAR organizations, we rely on volunteers who have other jobs, and we ask a lot of them. So I've done my master's around first responder mental health, particularly looking at paramedics. And I've come back into surf lifesaving. And over the last 2 years, we've created a peer support program to try and meet the needs of the surf lifeguards in New Zealand. My own experience, and that would have been 15, 20 years ago, as a young lifeguard, we did things very differently. So I can remember after an incident, there was 5 of us involved. We were met after about 2 hours after at the surf club, and a random counsellor turned up, and we kind of had this debrief and didn't really talk much about it again. And I found that quite unhelpful. And as Gary mentioned, the research is pretty clear that kind of forced debriefing is usually not that helpful. So in what we've done to try and help support our lifeguards, we've developed a peer support program to meet the needs of our members, and it's been going really well. So what I'm going to talk to you about is how we did this, what our peer supporters are, and then of course take some questions at the end. So before I go any further, just make sure we're really clear about what a peer supporter is. So for us in surf lifesaving, it's by definition, obviously, a peer. So these are fellow lifeguards that have had internal training, which I provide them around. Some of it is around psychological first aid. Some of it's about their own stress management, confidentiality, informed consent, and essentially give them the skills to support their peers. And the evidence is really clear that for first responders, one of the top 4 things that is helpful, particularly after incidents, is social support. And we do that anyway. We're really good at connecting as teams and supporting each other. So to have somebody else who's a colleague, a peer, support us after an incident and in that period is really effective, particularly compared to getting an external person in those early stages. So a little snapshot of surf lifesaving. So we have 4,500 to 5,000 lifeguards, depending on which time of year. They're geographically spread around New Zealand. So we've got 74 locations. We've got volunteer patrols mostly on our weekends. And then we also have a number of after-hour search and rescue squads, which are really well trained. And just to give you an insight into how much work they do, last year, about 726 rescues were done. And I think a really interesting thing across New Zealand with those lifeguards, 147 were involved in either doing CPR, body recovery, or something very high level kind of work, which resulted in like a near-death situation. But the majority of those 147 exposures, so that's members that were exposed to incidents, were involved in a resuscitation or something related to a drowning. So when we look at that and I think about my job, there's a lot of risk for psychological harm in our organisation because we expose our members not only to a risk of trauma, but there's a really unusual context where there's a real infrequency of exposure. So my experience as a paramedic was very different because we knew when we turned up on a shift, we would go to all sorts of different potentially traumatic or very high level kind of events. Whereas for a surf lifeguard, they may go for a whole year, a whole summer with kind of not much happening at all. They're having a great time hanging out with their mates, patrolling the beach. And then for whatever reason, next year at 2 o'clock in the afternoon on a Sunday, they're doing CPR. So they go for huge periods of relatively low stress, definitely not very low stress, but there's periods where they're in their kind of comfort zone, they're patrolling, they're doing a lot of preventative work, and then thrown into really extreme levels of stress, and we demand a lot from them. So my challenge is how do we support each year these 147 lifeguards who are of a range of ages and experience. So that's our geographical spread, and I think that's really important because one of my challenges is not just training a peer support group, but actually how do we get peer supporters to attend to an incident at the very bottom of our country, the South Island there, or the very top, which is almost a 2 hours flight away, at a remote location. So the peer support has been really helpful in not only being an effective way to support members, but logistically having local people trained to provide wellbeing support has allowed us to provide immediate support throughout the country. We're not using counsellors on a same day, but one of the challenges with that model is to try and arrange a mental health professional at short notice to provide support is also complex. So what we have is around the country, we've got peer supporters located at each club, which are able to be activated if there's an incident that occurs. When we think about the evidence that we're basing peer support on, it's really simple. It's really clear that resilient first responders generally use psychological support and have strong social support. Those two factors are really helpful. So that's where we put a lot of our effort in. So we have a really good counselling service available to our members. And we also have our peer support program, which really focuses on that social support part. What we've done is we've used the social support, the peer support to more focus on post-incident support to keep it much lighter. And then we've used psychological support for the weeks after an incident for check-ins. So part of our solution, so what we have now, when we looked at that geographical spread and the large number of trauma exposures across the country, is that we have 174 peer supporters, and they've all been put into 15 of those geographical groups. And those peer supporters all have training, not only in day-to-day things, but they also are able to provide a post-incident, what we call a wellbeing debrief. So it's not a classic critical incident debrief, but it's a peer supporter will turn up on the same day and provide some really light support to those members. Some of it is like what Gary mentioned is around just normalizing that humanity of an event. So one of the key things they will do is acknowledge the impact of the event and actually just normalize some of those things and just explain about that high sympathetic tone that they'll have, maybe the inability to sleep. I love Gary's idea about burning off that adrenaline and getting the body more regulated through exercise. So it's some of those really basic self-care things that our peer supporters provide after an incident. We don't have any same-day counsellor visits, so it's peers. So the person who turns up at what we have a surf club or the base, the peer supporter turns up, it's usually someone they know, and they know them well, and they're usually really happy to see them. The counsellor that we have, the counselling service, become involved later on. So part of our peer supporters' role is to get the names of everybody involved in an incident, and with their permission, we have a counsellor who's quite experienced dealing with our lifeguards. We have a pool of them. A counsellor will call each member from that incident 48 hours after the event and then 2 weeks later. And we call those well checks. And some of them are really, really brief. They, a person might be doing really well at 48 hours. And another person may, for example, not be at work because most of our members are volunteers. So 48 hours later, a counsellor gives them a call and they're off work, they're feeling overwhelmed, and we're proactively reaching out because we know the evidence is really clear that for first responders and for most people, but particularly for first responders, it's actually really difficult to proactively yourself access counselling. So we've tried to make it quite process driven. So it's not, if you're really struggling, let us know and we'll sort you out some support. We're going to say, hey, look, you've all been involved in a resus today. Our normal process is to get everybody checked. And with that approach, we find that the overwhelming majority of our members say, yeah, sure, I'll have a well check. And it's become ingrained as part of our culture. So just to recap there, if we have a drowning at a beach, peer supporters provide a basic debrief on the same day. We don't have any counsellors turn up at that point, but by telephone, we have a 48-hour and a 2-week well check. So that combination seems to work well because we get a mixture of both, but we're not overwhelming our members straight after an incident. In any training that we do with our members and any promotion around peer support and our counselling service, I'm always really clear that we're focusing a lot on a proactive approach. A lot of areas where we've kind of gone wrong in the past is that we've been historically really reactively focused. When something goes really wrong, we'll get all of the support in and overwhelm people. So what we're trying to do instead is to say, hey, we want you to have the tools to turn up at the beach, or, you know, for your search and rescue squad, we want you to have the tools to do well. We already want you to have psychological support in place because we know that it's more likely that you'll need it for something outside of your search and rescue role. So if you're having a relationship issue and it's causing you huge amounts of stress, we know that if you get psychological support and for that, you're going to be more resilient when you turn up for your search and rescue activity. So I think that's, yeah, I'm always using, trying to use proactive language and encourage people to proactively talk about wellbeing. And I really love events like this because it's extremely proactive. We're not here tonight because something has gone wrong and we're all online quickly trying to catch up. We're here to learn. We're here to proactively think how in the future, when we're engaging with our members in SAR, how can we make things better? What can we do? Like, I've taken some notes when Gary's talking. To how can we support our colleagues? So that's all proactive stuff, which I think is really great to ingrain in the SAR culture and not just use wellbeing or just bring up wellbeing when things have gone wrong. So talking a little bit more about incidents, because I think that's a hard thing to get right. We need to provide some support to our members after an incident, but as we have become aware, too much support, too much straight away is going to be difficult. We are providing same day support because the nature of our organisation with a lot of volunteers, you get them together on a Sunday, say, and they're doing their lifeguard duties. They all go off to different places and it's really hard to get them back. So ideally we would run something maybe 2 or 3 days later, but if people have travelled an hour, 2 hours, half an hour from all over to get somewhere, while we have them there, we take the most of that opportunity, and that's why we run that really light debriefing on the same day. So that's that's a nuance for our environment. But if you've got teams that are working together day after day, you can have, by all means, get-togethers and share food and things days later, which is also really helpful. So on one of our beaches, and this is a scenario actually here, we had a couple of years ago where there was a child and an adult being resuscitated from a boat that had rolled over. So extremely traumatic, stressful type event at a pretty safe beach. So it's a very unexpected event. So what happens on that event? So lifeguards are doing CPR on the beach. Peer supporters who are not involved in the incident, so they're at home somewhere in the community, get activated by our comms network. So the group of them in that area get a text saying CPR underway at X location, 2 peer supporters required. So that group, mass activations, almost like a pager to the cell phone, they respond. So we have 2 saying, yep, I'm this distance away. They respond to the location and then from that point provide some support for members. And a lot of it's really basic stuff. It's making sure that they've got warm clothes, maybe a cup of tea, particularly organising some food to facilitate some of that just natural chatting and really helpful social support. And importantly, these situations are, the atmosphere is often quite awkward. There's a lot of emotion. Sometimes the deceased person's still somewhere on the premises while we're waiting for the police. The peer support is there just to support the people that they know in that quite difficult emotional phase. Before everyone leaves, they will do that really light wellbeing debrief, particularly talking about the short-term, normalising that human response, and then arranging those counsellor well checks for all members that will occur 48 hours and then 2 weeks post-incident. And the peer supporters, they generally know these people that they're supporting, which is really great. So the rest of the process for them is quite intuitive. So they will, based on their assessment on the day, generally they will in-person and a combination of in-person and telephone follow up as needed. And that's going to depend. So if it's a Sunday and we've got some 14-year-olds on patrol, a peer supporter may call a parent and have a discussion with them about their child, essentially, or the teenager that's been involved in this incident. If it's more one of our senior search and rescue squads who are really experienced, the peer supporter may do much less and be much less involved, as they often have their own ways of debriefing and supporting each other. So from this experience, there's some key ingredients that I think are needed for a peer support program. And the first one I think is pretty obvious. Getting the right people is key. If you get the right people, I mean, training is really important, but if you get the right people and they've got the right relationships, the right reputations, when they turn up at a beach or at your location, people go, oh, thank God they're here. Or, or it's relaxed and it's quite, peer support can be very intuitive. So the right people is so important. Part of that process, we would get, supervisor approval and endorsement from, so whatever surf club they are located in, the management of that surf club will endorse that person. And they also have quite a detailed application process to get a bit of an understanding of what their background is and why they want to be a peer supporter. The next part's really important too, around diversity. So the right people, the first point, isn't the people with all of the life experience. And sometimes people say that, it's like, oh, we need to make sure we find someone who's, got loads of experience and lots of mental health qualifications and that sort of thing. But actually diversity is so important. We want to have people in a peer support team who can relate to different people in our organization. So we have peer supporters as young as 18. And we have peer supporters that are extremely senior and experienced as well. So what may happen is a member who's 17 years old is having some challenges, maybe being bullied at school. They talk to a peer supporter who's maybe in their 50s about it. And he says, hey, look, you know what? I know someone who would be great to talk to about this. And they can connect them up with someone who's closer in age. Because we need to keep in mind the definition of peer support by name is they're a peer. So when we are recruiting for the right people, we need to make sure that we have diversity. There's a few of our peer supporters who actually aren't active lifeguards. They're parents who are or associate members of our clubs, but they're also really helpful because they are, if a parent's worried about a child, what a great thing to have some peer supporters who are actually parents to connect up and support those other parents. Having good support in place for the peer supporters is key. We can only train people so much. It's about actually providing them with support while they're out doing that. So our counselling provider is available to all our peer supporters, and it's part of their training, and the expectation is when they deal with people and they're supporting others is that they actually check in and get some support around how to do that. In my role, I'm generally available. There's a colleague who I can refer to if I'm away, and I'm available to help peer supporters with some tricky things that arise. We provide ongoing training. I'm a big fan of smaller bite-sized training. We can't train people for weeks and expect them to remember things forever. So after we've provided them with the original training, which is about just over a day's worth of training, we have ongoing training which tops that up. So a part of that, we get guest speakers in on topics such as around trauma, youth, all sorts of things that they can use, might be around communication, whatever topics might be helpful to slowly build up their skill set. And as a requirement of being a peer supporter, they have to engage in supervision, which is really exciting that we have the capacity to deliver that. So peer supporters, to maintain in their role, they have it as a minimum, they have yearly supervision, which is, I think, great in our organisation because we don't have a large number of incidents. Each member, on average, doesn't attend a large number of incidents, and the peer supporters often don't respond to that many. They might do 1 or 2 a year. So we reflect that by having one supervision session, which is a mandatory minimum. Effective tasking is crucial. So we've got these 174 peer supporters throughout the country. One of the biggest challenges when I was setting this up was how on earth, are we going to get hold of people? I don't want to be the person having to dial all these numbers trying to connect peer supporters up with incidents. So we've got a really automated tasking system. So a search and rescue squad we have on standby gets tasked to an incident. So a lifeguard search and rescue squad, very soon after, a peer support network will also get tasked. So that's great for me because I'll be on holiday and I'll see a notification on my phone saying peer support has been tasked to X location for X incident, and they arrive and they have the training to do that post-incident support and organise those well checks. And the last ingredient I think is really important is simply a handbook. So again, we're asking a lot of a peer supporter, particularly in the incident space. They're turning up to something where they're potentially people they don't know well. There's high emotions. It's going to be awkward emotion and an emotionally intense situation. So we provide them with a handbook so they've actually got some instructions, some key things that they can say after an incident. Some of those, we follow a model, something like IMRF called manners, which is an acronym. The A is around acknowledging the impact, and the N, normalizing. So they start following things like, just a few prompters. There's phone numbers that they can give to members. And then there's also information about how they set up those well checks with our counsellors. Because, they may do, say, one incident a year on average. That's probably higher than average. So if we're doing something once a year, we're not going to be overly comfortable and fluent necessarily in that. So the handbook allows them, they might arrive in their car, have a quick flick through, or a bit of a study up in quieter times to keep them really up to date with what's going on in the peer support space. So that's the ingredients. It's been an incredibly rewarding thing to set up. Satisfaction. So we have a member survey which goes out to our 74 clubs each year. When I started my role, there was 50% satisfaction around incident support, EAP, and peer support. So we've changed our counselling provider to make it more accessible. So our counselling provider allows members to choose their own counsellor. They can book in directly. We have no limits in terms of what people can access it for. So we encourage people to proactively use it, which I think has really helped. And the introduction of the peer support program has really increased satisfaction. So it's gone from 50% satisfaction to 90% in a period of 18 months, which is really cool. And the rewarding part is that I often get compliments about the fantastic support that was provided, but I'm actually not there. It's the members. So we empower them, we give them the tools, and people will always do much more than we ever expect to support their fellow SAR members, which is I think an extremely rewarding part of my job, to not be there and then to know that members were looked after in an outstanding way. So that's the key overview of our peer support program. I think one of the key things is that everyone is going to require different things from different people. So a combination approach, I think, of having peer support and counselling seems to work for most people. So thank you for your time.
That's awesome, Ari. Thank you very much. And I must compliment both the speakers, one on their presentation, but two were bang on time. I think I went slightly over time, and both Ari and Gary have done really well and kept us right on time. So before we do go to the open questions, and thank you to everyone that sent some of those through. If you're wondering where they've gone in the chat screen, I've moved them across to questions, and we'll get to those shortly. But I guess just one question from me, Ari, on your presentation. I guess when you ever introduce a new program to an organisation, much of that is a learning curve, and there's been some questions or requests for some of your handbooks and for your presentation. I guess for those online, what was probably one of the biggest challenges that you found as part of this program? And if you had to do it again, what would you do differently, if anything?
Well, one of the interesting challenges that came up, which actually ended up being really helpful, is that we started this project during COVID. And one of the challenges for me was we was going to spend a huge amounts of money and logistics to get people in person to do this training. But because of COVID, we ran it online, which proved to actually be a really effective way of running the training. So interestingly now, kind of in the post-COVID era, we still run a lot of our training online because we're able to get access to members around the country and actually provide quite a private in-person space where we put people into breakout rooms and that sort of thing. Because that was one of the real stresses in my role, is the logistics of how do we get these people together to train them. They're all volunteers. So that was one of the big learnings. And I think I've learned this over time myself, and just through talking to lifeguards, is that we have a lot of paid staff that sit in offices, including myself. When we turn up, when something really big happens, we often escalate things. And whenever we've escalated things a lot, members haven't liked it and it's been unhelpful. So I've really learned from the members and talking to them. So the bigger the incident, I almost have to hold back my colleagues and say, the less we do, because my colleagues in the office don't turn up most of the time on the beach. If something really terrible happens, it's the last time they probably want to see you. So it's like, the work, we've got systems. Let's keep it super simple. The bigger something is, whereas the temptation is to all these random people turn up, becomes overwhelming. So we've really learned that as we've gone to actually, the magic happens when we're not there, and we actually leave things to be quite simple.
That's good. Thanks, Ari. Now, I might get Gary, if you could just turn on your camera, and Tom, we might just stop sharing the slides, if that's okay. I can actually do that from here, I think. There we go. So, good to see you back there, Gary. We'll just check your microphone's on. I will move to some of the questions. And again, thanks to everyone who's written something there. I might just give Ari a slight little break because he's been talking for the last 15 minutes, 25 minutes, sorry. I'll throw to you, Gary. The first question, which I guess follows on a little bit from the question I asked earlier, but and this is from Andrea Smythe. Firstly, that was awesome, Gary. Are there ways to reach the younger generation, and is this different for more mature people? So I guess it comes back to that conversation around this is a new way of thinking around dealing with stress disorders and or just stress in general. And is there a different approach for different generations?
Yeah. Firstly, Ari, thank you. Spot on. Great presentation, great program, and you nailed it when you said that we can rush in too early. And what that does is to give people a lack of confidence that they're dealing with it. As you say, if they're waiting at the wharf, they think that I'm not dealing with it, but I am. And so, good on you. Well, and to come to that question, Alex, everyone, no matter what age, has got a brain. And no matter what it is, whether it's a critical incident within our marine environment or beach or road or wherever, people still get stressed and their brain reacts exactly the same. So we've found with student police officers, they've come from school and high school, and the biggest stress they've ever had was their examinations to leave high school and go into uni. And so we've told them and explained to them the anatomy and physiology of the stress response, whether you've been in the job 40 years or 4 years. Once they understand that, and their families and colleagues understand it, and they're all respond like betrayal, no matter how old you are, you respond to it. Grief, now the definition of grief is a loss or change to a situation that you didn't ask for and certainly don't welcome. And so there's the same response physiologically to every age group. And so we find that even young teenagers who have been betrayed online, and by the way, there's some research came out recently from the US that shows that all of those mass shooters, those shoot up schools and factories and anywhere else, and including our Martin Bryant, who had mass shooting down at Port Arthur in Tasmania, every one of those shooters were bullied at school or in the workplace. Every one of them were victims of bullying. And so part of the stress response was for them to take control, of a victim once, but now I'm taking control and this is payback. And so we look at betrayal and moral injuries, the other one, where they may do something they shouldn't have done, not criminal, but morally, or haven't done something that they should have done, or vice versa. And so with the anatomy and physiology of the brain, Alex, we're explaining to all age groups what that does to them both, and psychologically, physically, and spiritually as well. Their worldview changes when they see massive tragedy, and so it goes across the board. Same as suicide prevention. I've developed a 6-minute intensive training, and Ari said spot on that people can't afford bulks of hours and hours of learning stuff that may be relevant one day but not each day. And so developed a suicide prevention workshop, which is 6 minutes only. And we call it SMIT, 6-minute intensive training. So we go into a work site, an office, a life-saving or a corrective services, ambulance, police, and we just give them the basics, the real good facts on suicide prevention, and then we let them then make further research. And they love it because, again, as Ari said, you don't shove a loaf of bread down their mouth. You do it a slice at a time, and they can tolerate a slice. So to summarise, Alex, so I went on a bit there, all age groups benefit by learning the anatomy and physiology of the brain in the way I did today, a very simple terminology. We try and throw out terminology because that often confuses them.
So just following on from that, one thing that I guess we grapple with from an organisation perspective, being predominantly made up of volunteers, the strength of our organisation is the background diversity that people bring to us, but also it can, it's a recognition that a lot of our people that do come and join us are, ex-police, ex-military, come from other emergency services, and in many ways they bring previous scars with them from an organisation. And I guess both of the presentations tonight have been in many ways about the reactive, how do we deal with them? How do we encourage them to understand what's happening to them from a, blame the brain perspective, as you referred to it, Gary. But from an organisational perspective, what do you recommend from a proactive perspective for organisations to be doing to better arm our volunteers or our paid members of staff to deal with it and to see the signs?
Exactly what Ari's doing is training and education, Alex. Their induction, part of it should be explaining what trauma does. And that way, when it does happen, I'll give you a quick example. With the young police officers, we go into the physiology of the response. For example, one of them said, I went into a situation, I started shaking. I said, well, you weren't shaking, your brain caused you to shake, because when you go to the gym, or I used to play football, you'd warm up. You'd warm up before you went into the game, so your muscles are nice and warm and you've got some blood in those muscles. But with a critical incident, it happens often so suddenly, you haven't got time to warm up to do physically fight or flight. So what happens is you start shaking and the muscles start twitching and rubbing together the fibres to do a quick warm-up. So the friction causes the muscles to warm and to dilate the blood vessels and bring blood in. And so you say, well, that's why you shake. So if you're shaking, that's okay. That's your brain preparing you and getting you ready for a fight or flight. Oh, so it's not me losing it. No, it's your brain very cleverly getting you ready. And another quick one too, Alex, is a police officer came up at a critical incident and he said to me, he said, Gary, so-and-so's gone really pale. I said, yeah. He said, well, is there something? I said, no. He said, this situation, what the brain has done, it's diverted the blood supply from the surface where it's not needed into particularly the heart, lungs, muscles, and maybe brain, to get ready for fight or flight. So you go pale because there's a diversion of the blood supply. Oh, is that okay? That's what the brain does to get you ready. Oh, that's all right. So what they used to think in their uneducated state was a lack of understanding is the person is not coping. Well, hang on a minute. No, we've trained them that their brain now is preparing them for it. And it's a major breakthrough because they're learning to cope with the stress response while they're enacting their actions and going into that situation and doing what they do.
That's good. Thanks, Gary. There's a question here for Ari. It comes from Simon Marshall. Has Surf Life Saving New Zealand considered the proactive contact of 1 hour, which I think I've said that right, and family of the crew by a phone call to a spouse to say your partner has been in an incident, what to look for, those types of things, and not quite sure what the mechanism needs to be to put that in a place to allow this and it's fairly well known across the sector that the family are important members of our crew and support group.
Yeah, that's a great question, and I think simply we could do more work in that space. With our younger members, there's a real focus on that, and I know it's always really helpful. And I don't think it necessarily needs to be an age thing, but I know if we have members under the age of 18, we generally encourage, we request that we can contact their guardian, and the guardian's always really happy to hear from us, and they often require more, are more interested in the information than potentially the person involved in the incident. I think that's really great. But yeah, so I think the only thing we do is we're lucky enough to have these wonderful buildings on the beach. So we're able to invite family whānau to those locations. So not incident specific, but indirectly we are. So my experience in ambulance, it's very rare for a family member to come to an ambulance station. But at a surf club, we can have barbecues and events like that. So I think that's probably helps me feel more reassured in that area, because we're lucky enough to have that. But yeah, I think we definitely can do more deliberately in that space. But it's probably just hard, I think. So when we're not dealing with youth, people are quite specific about the way they want to deal with incidents. So particularly if I think there's some members in our search and rescue squads, some of them have deliberately don't want to involve their spouse. So it's just trying to weigh up that for them. So I think probably proactive opportunities, so rather than after incident. And I know of events that other organisations have done to say, hey, we should invite the family in and before the start of a busy season and explain what you could expect and how to support your partner if something were to happen. I think that proactive space might work more. So it's a great question. It's got me thinking.
Yeah, Alex, just on that one, Ari's spot on there. Some years ago, as the duty officer, I went to an incident where sadly and regrettably a 13-year-old took his own life using a shotgun. Won't go into that, of course, and one of the young police officers at the scene who broke in and found his body there and then the crime scene and so on, he went home and his wife said to him, "Oh, how's your day go today, darling?" And he said, "Oh, yeah, we got this 13-year-old that took his own life." And he then explained the scene in the study where this occurred. And his wife was horrified, ran into the laundry, shut the door and said, "I don't want to hear it. Shut up. I don't want to hear it." And she's quite dry reeking. He came into me next morning and he said, "Sir, can I see us?" I said, "Yeah, what happened?" He told me, he said, at the academy, this is some years ago, he said, they told us to go home and share the job with our family. Don't leave them in the darkest and let them understand what you do. And that way you'll get more support and understanding and so on. And he said, I did that, and now my wife doesn't want to have anything to do with my job. And I sat with him for a while, and cut a long story short, I thought through this. And I went in to see our crisis unit, the psychologists and so on, and I explained what happened. And I said, I've come up with a solution. Let's introduce the FF principle. Leave the facts at work and take the feelings home. And so we've done a complete switch where, look, to be really base and frank, we leave the blood and guts at work and discuss it there amongst our peers who attended the scene. Try not to vicariously traumatise who didn't attend. And when we go home, we've changed the language. Oh, what did you do at work today, darling? Look, I'm so sad feeling. We've got a 13-year-old took his own life, full stop. And I feel angry because he's wrecked his life and he's not going to go ahead and get married and have kids. And I'm feeling really sad for those left behind. And so feelings are repulsive. Push them away. Facts are embracing. Come here, darling. I'm so sorry that you feel sad about that. I can understand why you're sad. So feelings at home and leave the facts at work is working marvellously to share their feelings, but leave the things that might traumatise their family and friends back at work where it belongs. I don't know what Ari thinks of that.
Yeah, I think, and it's just quite a specific. People have just such personal views around it. Yeah, that as well. So I think, from peer organisations, I think, that proactive sort of family events and networking other spouses and partners together for them to support each other is also, there's some really interesting and concerning evidence that around trauma with partners. I think probably one of the most interesting things is just around how sometimes the partner has a more traumatic experience than the first responder, and that the way they imagine something is, they may think it would be, they may say, oh, I went to a car accident yesterday, what they're picturing is actually worse than the actual reality in some cases, because they don't have that experience.
And I guess probably just on the flip side of that is, if you're constantly relying on your fellow workers as your support mechanism, there's a risk of desensitization around the nature of the incidents that you're attending, because everyone's had multiple exposures. And I guess sharing your experiences and your stories with people outside of your organisation or your work colleagues probably gives a reality check sometimes around your emotions and the nature of the incidents, because too often in your workplace, events, distressful events are normalised because of the nature and the repetitive nature of them. So I think it's probably a double-edged sword, and one I certainly don't have the answers. I'm not an expert, but I guess talking from personal experience. Moving on, because I'm conscious of time, but I'll probably merge two of these together, and one's actually from a member of Marine Rescue. So Jonathan, great to see you online, one of our unit commanders from the North Coast of New South Wales, and also from Graham Harding. So the first question is really from Graham: is there enough preventative or preemptive training being done instead of waiting? So I'm interested in both of your views. And then how do you best get that message across to your crews or to your organisations? So I might start with you, Gary, just on that.
Yeah, look, as new research emerges, both academic and lived experience, merging them together, keeping updated, and training and education is vital. And sometimes just describing to them, as I mentioned, what happens to them when they get stressed and post-stress. And that way it's not a surprise when it happens. And when I joined the police, they marched us straight into the mortuary where there was a post-mortem taking place, an autopsy. We got the body on the slab there, and fortunately I was an ambulance officer prior to joining the police force, and so it was second nature to me. But some of the others were just totally and utterly taken by surprise, and they even laughed about it. One fainted and one ran out of the room, and others were not looking. They're turning their head away. And it was a big joke to the senior police who took us down there. Whereas what we're doing now is bite-sized chunks. And so we said before, we verbally describe what happened, then we show them black and white still photos and coloured still photos explaining the anatomy. So they look at it forensically and not grotesquely. And then some black and white movies, coloured movies. And we take them for a tour around the mortuary first without any bodies exposed. And then we show them a body and explain rigor mortis and what death does and all the rest of it. And then gradually work them up. What that's doing is developing a photo and video album in their brain. And so the brain tattoos memories, so it creates a photo album. And then when they go out on the scene, when they graduate and they see a body in a situation, then the brain says, no worries, I've seen that before. I know what that is, and I know what that is. So it's okay, it's sad, but I know what this is. And so it's a training, education, and gradual exposure to give that experience.
Your views, Ari, just on those two questions?
Yeah, I think that's interesting. Like, now we have our peer support program. Doing proactive training is a real priority. Trying to get people involved in training is always a challenge. Sometimes we have this sort of irony where the people who are the most interested and keen about wellbeing, maybe we have that tonight, and some of the people we want to hear about it the most aren't engaged. So it's just trying to find ways that we can embed it. But one thing I think that's great we've started with doing training is that we can publicize it, and photos of members doing proactive training has a huge value. So even if people aren't there attending the training, if the organization's doing proactive things, I'm always reminding my colleagues, the value of this isn't just the 16 people who are in this photo. It's the fact that we can send it out to our 5,000 lifeguards and they can see members that they might respect participating in wellbeing training. So I think, yeah, that proactive culture is really important. And I think that what to expect part's a real hard one for me. So I think we're making headroads in the training part, but trying to train new lifeguards and new SAR squad members around what to expect and trying to is difficult, because I know that element of surprise has a huge part in trauma, and just trying to get people to have realistic expectations, I think, is an area that we need to work on more. So it's quite interesting just listening to you then, Gary, talking about that.
And just quickly on Ari, that there's a question here around, do you think, as a next step, and much of this would probably be capacity based, it's hard enough for organisations in many ways to train their own members, let alone the members' family, but providing some level of training, whether it, would it be through online portals or just documentation, but is there value in actually providing some level of training or better understanding to family members of emergency service workers?
Yeah, I think for sure, and that's given me some food for thought. I think it would be interesting, even in an online forum like this, wouldn't be difficult for us to, or any of us in our organisations to, it doesn't have to be a wellbeing expert necessarily. It could be a panel like this of some people, and providing actually a Q&A about what members do. And some of it could even, I think those opportunities are good because myth busting is really important as well. If I think parents of some people in an organisation, when they understand the statistics and the likelihood and things, they might be a bit more reassured around what their loved ones being part of. But I think training family members is probably a really easy one because it doesn't need to be overly complex.
No, okay. No, that's good. And probably following on from that too, Ari, just for you, there's a few questions here around, the training that or the opportunity through peer support that you give to your first responders, I guess, on the water. Is that training or is that peer support available to people that are working in radio rooms and doing comm support and those types of things? I'm sure it is.
Yeah, it is. It definitely is. I think with we have a pretty small comms room. So we provide probably them more with some supervision as well. Because it's quite a unique environment, and I think they are available to the comm staff, but it's probably that's something we could it is available to the comm staff, but I think because we probably only have a group of probably eight in that group, so it's much easier to get them together as a group and actually provide them with some peer supervision as a unit.
Yeah, and look, I know from our perspective at Marine Rescue, our radio operators are a third of our business essentially, so they're really very much part of our frontline services, and we make a conscious effort to make sure that we don't forget them as part of any of our after action debriefing. They're really part of the whole incident from start to finish, because there is a recognition that even though they're actually not out on the water, they are part of the emotion that goes with any response. So we make sure that we include them as part of all of our debriefs and make sure that there's that after action care for them as best that we can do, noting there's always improvements. Look, I'm very conscious around time. I think I'm just, Tom, I know you're listening. There's a couple of questions there around the availability of both Ari's presentation and some of the other things that have been spoken about tonight. So, Tom, if I could get you just to have a look at some of those comments, and if you could provide some feedback or please feel free to turn your camera on and provide it, whichever you choose to do. Gary, there's also a question around whether or not you're 6 minute or you're SMIT. I had nightmares when I heard SMIT from back in the police days, but I think it is a really effective tool to get a message across quickly. But if that is available, we could probably share that through me, and I can make sure that it gets through to Tom, and we can make that available to others if you're happy to share that.
Oh, absolutely, Alex. It's life-saving information, so absolutely. And, I'll send a presentation too on Blame Your Brain, and today it was more of a conversation, but I'll do that for sure. Yeah,
no, that's great. Look, I mean, I am conscious of time. I do want to try and wrap it up at 8:30 here in our time, or close to. I really do thank everyone for staying online. We've only just lost a couple in the last few minutes, and I know that's probably because we're getting close to the end of time. But Gary, have you got any other final sort of comments that you want to make before I wrap up? And Ari, likewise for yourself. I know I saw a note that you may have lost your volume, so I'm not sure if you're back. But Gary, just any sort of closing comments that you'd like to make around this?
Just be concerned about your people, award them and commend them. That's important. And I guess too that one of the major breakthroughs is that don't use statements anymore. We switch statements to questions. And for example, statements can be torpedoed. Like, for example, oh, you look shocking after that incident. Switching that around to say, hey, listen, what's on your mind after that incident? That's the cognitive. What emotions are you feeling after that incident? That's the emotional. And how's your thoughts about life in general after that incident? That's that spiritual side of things. And so a major breakthrough in avoiding or reducing traumatization with traumatized people is switching statements to question form. And I want to congratulate anyone and everyone here. Thanks for your service. I was in the rescue squad and I was in other places, but I've never done anything on or under the water. So each one of you, from the surf right through the ocean and whatever you do, I admire you greatly. It's something I've never done and didn't want to do. And so it's amazing. Thank you for your service.
No, thanks, Gary. Thanks for sharing your knowledge and for your service over a long period of time. If the presentation was 2 hours, I would have read out your bio because it's certainly impressive. And I hope, and I know Caroline, as the CEO of the IMRF, and Tom, I'm sure will look for opportunities to engage you again into the future. And thanks for giving up your time. Ari, are you back online? Can you hear us? No, we seem to have lost Ari. Look, I will wrap up. Again, thank you everyone for jumping online. The success of these webinars for the IMRF is really about the participation, and we really want to make sure that we encourage more of our member agencies really promoting these events and getting as many people as we can online. I'm very much a believer that the success of the IMRF is on the backbone of the agencies that choose to join it, and the input that you give so that we can continue look at opportunities to spread the message, to share the word. There's so many member organisations that have got great lessons and great programs running out there, and that really is the strength of the IMRF, is that opportunity to share ideas and share learnings and collaborate amongst each other. So please keep joining these webinars, looking for opportunities amongst yourselves to share that story. Can I just thank Caroline and Tom? Tom's online for facilitating it. I hope it's been a good session, that everyone's got something out of it. From my perspective, all I can say is that you really continue to have these conversations within your organisation. I said in my opening that we've come so far over the last few years, and in relation to how we look at mental health, and particularly amongst our fellow colleagues and our emergency services workers. And there's no better way of doing that, just to actually having that conversation with someone around the coffee cooler or on the back deck of a boat and just ask how they're going. You get to know you people you work with, because I think in many ways that's the best way to understand how they're actually travelling. Ask questions, get them to share their stories, and be a supporter amongst everyone. And look, again, thank you for the time, and I hope everyone stays safe in their roles that they've got out there. Doesn't matter what your role is in the organisation, we've all got a role to play in promoting mental health amongst our members. So thank you. Enjoy the rest of your day, or for those that it's night time, sleep well.